Okay, we like to make sure that we post these meetings just in the event folks can't make it, but also just to make the information readily available to the public. Our expectation, though, is as a committee member, you'll still attend, right? I definitely, when I was going to graduate school, took advantage of the recorded class option, but hopefully we can stay engaged. So thank you again for creating the time today. My name is Lauren Anthus. For those of you who have not met me yet, I'm with the Center for Community Solutions, and I'm helping manage our project here today. So our agenda, we have a few things to go over. First, I want to talk about our membership. Last time, you may remember that we had a discussion regarding how to fully flesh out the advisory committee. We decided to sort of freeze where the enrollment was as is, but I wanted to take a moment to talk about our new members and offer them the opportunity to introduce themselves. Then we'll also talk about research timing and survey design. As you may remember, there are 3 phases to this work. The first phase is a planning phase, and that's where we're in right now. We're sort of getting to the end of that, where we really wanted to build out the committee, get some feedback about some of the tools and opportunities that we have with our assessment process. Then we move into our assessment process, and we'll talk a little bit about what that looks like, what the timing is, before we finally get into the action plan phase, with the project terminating so far at the end of 2022. Then we'll review some of our capacity mapping survey results. So for those of you who may remember, we sent around a link asking our advisory and steering committee members to indicate certain things that they may be able to contribute to our effort. Things like spaces for community meetings, maybe even listservs to distribute information, social media, that sort of thing. And that's going to play into our 4th bullet point in particular. But just to give you a sense of what responses we've heard, really appreciate everyone who took the time to fill that out. And then finally, we'll hear from Patty and Ebony regarding communications. Specifically, one thing that we discussed recently was the ability to share information about what we're doing out into the community. So, the good news is Lakewood is a very active, close-knit community that has lots of events. So as events are taking place, how can we share information about the CHNA and action plan? How can people get connected to that work and learn more about it? So Patty and Ebony will go over some of the highlights of that and then share some information, as well as take any questions that you may have. All right, so first of all, I want to highlight our new members. So we have several new members here. Laura Rodriguez Carbone, Jessica Cotton, David Swekis, Emmy Hutchinson, Martha Halco, Marilee Santiago, Jennifer Ritt, and Timothy Dunphy. You can see the organizations that they're a part of. We are still waiting on some appointments from university hospitals and refugee response. We do plan on having those individuals identified here in short order, but I just wanted to make sure that you knew that we'd have that representation. So I'll take a moment here and ask folks who are present and on this list, maybe you can take an opportunity to introduce yourselves. So I'll start with Laura. Laura, do you want to take a moment and sort of introduce who you are, your background, and what you hope to see out of this process?
Thank you, Lauren. As you know, Laura Rodriguez Carbone, my background, I'm currently with the federal COVID response and transitioning into the Office of the Assistant Secretary of Preparedness and Response, working on medical supply chain for COVID-19. So the bulk of my work the last couple of years has been working in the COVID-19 space with high-risk patients on dialysis, then moving into vaccines and therapeutics, and now working into the public health supply chain. In addition to this, I have a background in public administration and political science. It's what my degrees are in, but I've been a community leader, community advocate for about 20 years in Northeast Ohio. I've served on about 21 boards, think tanks, and commissions. As for what I hope to see out of this, being in public health, you want to make sure that people are that our city can meet people where they are, that people feel that their needs are being met, that we have accurate information and data as to what those needs are, and that we actually have a feasible and attainable plan to be able to make people healthier in Lakewood, which is the whole point. So I'm happy to be here and lend any help I can, and I'll pass it to the next person. I think that might be Jessica.
Thank you. So my name is Jessica Cotton. My primary job is I work for the Northeast Ohio Regional Sewer District as a GIS analyst. I also am on our emergency management team as well. I have several hats. I chair our African American Professional Network employee resource group as well, and I represent the Anti-Racist Task Force of Lakewood. I also am part of several boards, and I can't name them all, but the thing that I want to see here is the plan, but also kind of realistic actions with those plans. We always make plans. We always have something written down and everything, but you see little actions with those plans. So that's where I want to see here.
Great. Thank you, Jessica. I also received a note from Dave. He is currently on a cruise ship in the Caribbean, so I will send out his cell phone. Feel free to text him how terrible he is and how unfair this all is on your own time. I won't do that, and please don't do that. But thank you, Jessica and Laura. Next on my list, I see here Emmy Hutchinson. Emmy, would you like to introduce yourself?
Sure. Just a little correction. I've actually been on the past meetings. I represent the H2O Help to Others program with the City of Lakewood, but we have started including Amy Chodson, who is our assistant coordinator. She wants to give a wave, and Anika Rafai, who is our student representative. I know that she let you know, but Anika has an adjusted midterm schedule and was not able to join us. And I think what we hope to get out of this, our small team participating, is making sure that the plan reflects youth voice, and also being that really exciting gateway to civic participation for youth in our program.
Great. Thank you, Emmy. Yes.
Yeah.
Appreciate you coming back.
Yeah.
Next on our list, we have Martha Halko. Martha?
Yes. Hi, good afternoon. Martha Halko. I am the interim co-director of prevention and wellness here at the Cuyahoga County Board of Health. I oversee primarily the population health programs, chronic disease prevention, infant mortality, all our HIV, AIDS, STI programs. Probably for about a decade prior to that, I was also coordinating the Health Improvement Partnership Cuyahoga work, which was heavily steeped in our county health assessment process and implementation planning process. We, as an agency, support local efforts to address structural racism as a public health crisis. We take a very equity-focused approach to our work, and personally very committed to that myself. I think what I would hope to see is opportunities to align with priorities that have emerged from our county's assessment process, with the opportunities to leverage, obviously, where there are opportunities to do that. Also ensuring that there's an equity lens on the work that we do in the city of Lakewood as well, to ensure an inclusive process, and ensuring that we are hearing from everybody that we need to be hearing from in the community to inform our priorities and our plan. Thank you.
Great. Thank you, Martha. I appreciate you joining us. Next on my list is Marilee Santiago from Metro Health.
And thank you for having me here today. Marilee Santiago, the Director of Transformative Knowledge and Education for Metro Health in Hope. Hope stands for Health Opportunity Partnership, the big P. Partnership is really important in our work and empowerment. I am overseeing the Economic Opportunity Center that has.
Hey, Marilee, she may have been dropped. I think we were having some connection issues. We'll follow up with her and make sure she has the phone number to today's event so that we can ensure that she gets connected. But in the meantime, I would ask Jennifer Ritt from Signature Health. Would you mind introducing yourself?
Sure. Hi, my name is Jenny, and I am from Signature Health. We just moved to the Lakewood location about 2 years ago. We are a federally qualified health center that primarily serves, we serve adult or kids as young as 5, all the way through adults with behavioral health, primary care, and substance abuse services. So we have been kind of booming here in Lakewood ever since we opened up our doors, and I'm really looking forward to engaging with community partners because it really makes it feel like we are. I mean, there's so much wraparound services to be done. So I'm just excited to see what this is all about.
Thank you, Jenny, and welcome to the group. And I'll ask Chief Dunphy. Chief, would you mind introducing yourself?
Good afternoon. I'm Tim Dunphy. I work on the Lakewood Fire Department. I recognize a few of the names on the call today. So hello to those who I already know, and nice to meet the rest of you. I've been on the fire department for fire service for 31 years, starting today. So just happens to be my anniversary yesterday. I'm looking forward to being involved in this process. I reached out to David Boss and Sean Leininger about this initiative that you guys had put forth, and being, the first responders for the city of Lakewood, and the amount of calls that we go on, and all the different opportunities we have to meet with people. We average around 7,000 calls a year. We have a pretty good idea of what some of the healthcare needs are for the city, and if there's any interest in getting these identified and possibly serviced better, we're liable to be and more than likely going to be at least some integral part in providing that service. We have 2 members of the department that will primarily represent our department going forward with any kind of community initiative. We have a member that is pursuing and already has a degree in emergency management, but he's also pursuing a certification of what we call a community paramedic. It's more of a lengthy process. I don't want to get into the weeds on that right now, but certainly is something that is in line with the program that you guys are discussing. And the other member would be our EMS captain currently. He's about to move on soon to assistant chief, but his current position is the EMS captain, which provides oversees our EMS division. And again, that fits right into this this wheelhouse of providing the care and health needs to the community of Lakewood. So we're excited for the invitation, and thank you very much for having us. We certainly would like to help you guys in any way, shape, or form with providing better care and service to our citizens.
Great. Thank you, Chief. And thanks to all of you for joining us and joining this effort. In the interests of time and efficiency, I'll just sort of call out who else makes up this committee. As you may have seen in that slide, we have 22 total members as a part of this group. And our goal was to try to ensure that there is a good diversity of background, of interest, of expertise, so that we can make sure that this process is very robust. Included in that, we have Allison Urbanek from Lakewood Alive. She's a community member. We have Dr. Chad Garvin from Neighborhood Family Practice, Dr. James Hackman from Cleveland Clinic, Leslie Favre-Krogman from Lakewood City Schools, Michelle Nocta from the City of Lakewood, Reverend Laura Jasley from Lakewood United Methodist Church, who's a pastor, Dr. Sugata Bonik from Baldwin Wallace, Tammy Feaster-Price from Lakewood YMCA, Trish Rooney from the Lakewood Community Center, Lisa Bruning from Lakewood City Schools, Amy Chodson, who's a representative from the H2O as well, Aniko, who was mentioned earlier, and then obviously everyone else who's on this call. And also just as a heads up, Martha from the County Board of Health may be busy these days. So she has also enabled our process here by identifying Renee, I believe, who can fill in when she's not available. But I just wanted to make sure everyone had this information, so you know who else is a part of this committee and who else will be involved in our work moving forward. So last but not least, just a note to Mary Lee, we'll try to get you that phone number so that you can dial in via audio. I'm a recovering Metro Health employee myself, so I'm very familiar with taking calls in that cafeteria space and understand the limitations of the wireless internet in that space. So, all right, getting back to our deck here. And I will ask Emily Matillo, we good? We are good. Okay, thank you. So the first thing we wanted to go through here is research timing. So as I described before, we have 3 phases, and this next phase that we're looking at, the assessment phase, requires a lot of distillation of information. Some information will be readily available through publicly available resources. Some other information we might ask all of you to provide to us if you're able to. You know, like the City of Lakewood has a number of resources data-wise available on residents. And then also we want to get feedback. I think a really important element of our design with the assessment phase is that, you know, we take in the voices of Lakewood residents and have the resident voice define what wellness and health looks like when we're trying to address or document social determinants of health and ways to remediate it through material policy. So a few things here. You know, December, where we are now, we're going to try to gather some feedback from all of you on our survey design. In January, we're going to have a draft ready to get your reaction, get a sense from you all. How we are designing this and if it makes sense. Part of what we'll do internally, and to make a distinction between external and internal. External means anything that we may develop that's externally facing, moving towards the community or where we're going to collect feedback externally. Internally might mean working with you all as committee members or us as a CCS team, looking into information through the census, for example. So we'll start to review data that we receive or have already received from all of you. In February then, our hope is to distribute some longer form survey by the end of the month. We may need some help, some volunteers in that process, and we can discuss what that may look like. We'll continue our review of the data that we do have. Then we're going to, in March, April, check in on the status of our mail-in survey. So one of the things that I think we'll talk about here is how we want to use a mail-in survey, a longer form mail-in, to get a statistically representative sample of Lakewood voices so that we have an understanding of what the needs are. Internal, again, we're going to be looking at ACS and government source research. We had highlighted before how COVID-19 has interrupted typical census practices when it comes to timing of things. So, you know, we have to stay flexible about what data is available to us and the accuracy of that data. And then our hope is, say, around May, June, that our data collection process is complete. That will then allow us to enter into the action plan phase of our work. So with this, you know, there's a few things that we want to discuss. You know, we are interested in a survey, like I mentioned. The primary modality, we'll do a mail-in with a 2-month cycle. If we see that we're not getting enough responses or there's other opportunities to bring out more responses, we'll have a shorter online tool available to us. And then there are elements to this in terms of a collection plan where we have targets. So a 5,000 distribution target with a 10% response rate. So that leaves us with about 500 individuals. We may need some translation services depending on the population that we're reaching out to. We also may oversample based off of geography and response rate. So if a particular area of Lakewood is not responding, we may issue more or try to get additional samples, maybe even try to do some more direct outreach. With the assessment process, we'll also use focus groups and interviews to fill in or refine our data. So we'll be asking all of you for help in identifying who do we need to talk to, and we'll talk about that here in a minute. And then, like I said, the data collection, we want to be done by May so that we can fulfill our analysis in June and July, and then our target is to move forward with the action plan process in August. So I'm going to pause there for just a moment and see if my colleague Emily Matillo, is there anything that I missed here about our collection plan or the survey that you think might be helpful to address?
I think one of the things with the mail survey that we will maybe talk a little bit more about when we go over the capacity mapping, but we may be looking to your organizations and your networks to help us get that out to folks. So just, you know, kind of start the wheels turning in your heads about who you may be able to mail it to. We understand you probably can't give us addresses and lists, but maybe it can go out from your shop. But I think that's probably all. I think you covered it pretty well, Lauren. Thanks.
Thank you, Emily. So a couple of other things here. So survey design, some focus group considerations. You know, we had thought maybe there are key constituencies that we want to ensure that we address. Maybe individuals with long COVID, right? I don't know how many of you have heard about this, but there, or I've been paying attention. I think Laura might be one of these folks, but there are going to be folks who maybe were infected, who have longer term issues. Should we talk to them? Should we talk to them about what their needs might be? Persons with chronic diseases, persons with disabilities, immigrants and refugees. I think once we have that contact with refugee response, we'll try to focus in on them, youth, and maybe any others. So, you know, I want to sort of pause here and see when it comes to focus groups that we want to pull together. What do we think about some of our list here? Long COVID individuals, persons with chronic diseases, et cetera. Is there anyone that we are missing that we think we should target as a focus group? And you can either put that in the chat or you can unmute.
So, Lauren, this is just for the residents and community members, right?
It can be, but
yeah, I think it would be also good to understand the provider's perspective in the community, and like not only like healthcare provider, but social service providers. So I think a targeted focus groups on provider, those both for healthcare, social services, and other providers on as a provider focused focus groups will be beneficial.
That's a great suggestion. Yeah. So what are providers seeing? And not only providers, say clinicians and medical professionals, but folks who work in the human service delivery system within Lakewood.
Yeah.
Lauren, this is Trish Rooney. I think housing is playing a crucial role in health and well-being. I mean, it's deteriorating wildly from our perspective. And I think low-income renters they're going to be tough to get because they're reluctant to talk because they don't want to threaten their housing. However, there are a lot of them, and I think we'd be remiss to leave that group out. I mean, I understand that's the lens I see Lakewood from. You know, it's a narrow lens, but we have a lot of clients, and so does Human Services in Lakewood, and I think we'd be remiss leaving that group out.
Okay, great. And just a note for anyone who's offering feedback, we are taking robust notes here, so we'll indicate who offered the suggestion and what that suggestion was. So for example, you know, Laura, you had mentioned seniors. Obviously, Dave is on that cruise, but we may reach out to you for some help. Similar, Trish, with housing. If you know of organizations or folks who we should be talking to, we'll reach out directly. But that doesn't prohibit anybody here. If you know of any organizations or key contacts, feel free to send those our way. Like, you should talk to these folks about this issue, and we can incorporate that into either our key informant or focus group targets.
Yeah, this is Laura. I'm on the board for Fedor Manor, which is a HUD senior living community here in Lakewood. And I mention them because, you know, we do have space to facilitate in-person focus groups. And I believe I would be able to get folks in not only to the Fedor, but also westerly to do some door-to-door canvassing as well, if needed. So, I noticed that you had something, people with disabilities that are on the list. Seniors would definitely fall into that category, but not necessarily. So, for folks who are more able-bodied, we would want to make sure that we get those needs met because our senior population comprises a growing number of us.
Gotcha. That's very good feedback. Thank you, Laura.
So this is Jim Hackman. Today I'm that guy who's in my car calling in. I did want to make sure that we had on our radar this whole area of digital access and digital screening. And it may be helpful to have a focus group with community stakeholders who really do a lot of this work. So Digital C and PCs for People and those groups to see how well connected Lakewood is, to see where the needs are, things that probably haven't been identified in surveys in the past.
Okay, so what I'm hearing is maybe some level of understanding in measuring broadband access, internet access generally, that sort of thing, especially to your point, because we're relying more and more on virtual connections, obviously. And so your ability to be able to connect that way to your physician or to entities like us for this sort of process is important. Yeah.
And so also access to personal devices and literacy skills to be able to make use of that access in a meaningful way.
Great. Excellent. Thank you, Doctor. I'm also seeing in the chat from Dr. Hackman, he mentioned LGBTQ+. I think that's a great addition. Community-based organization partners focused on housing. So housing is definitely an emerging theme that we see coming up, particularly as we discuss social determinants. Small business owners, that's a great suggestion. Just a question, is there any particular small business owner organization within the city of Lakewood that folks know of or would want to suggest?
There's a chamber, I'm sure, or Lakewood Alive.
Yeah, Chamber Lakewood Alive has a couple contacts with like Downtown Business Alliance. There's I think I can't remember if they're still formed, like the Uptown Madison used to have a group. There's some ways that we can touch base through Lakewood Alive.
Gotcha. Okay, we will definitely be following up on that one. All right, excellent. Well, as I like to say, if you have any more suggestions, you have a great idea eating that bowl of spaghetti on Friday and you want to send us a note, just feel free. So if any other ideas come to the fore, let us know. And I'd like to put it out there, we have to be very intentional about our focus group design. We can't do 30 of them, but if there are key contacts that you feel are representative voices that are important to this process, we can do interviews with folks who might represent larger organizations. So if in your response to us, or if you have other ideas and you say you really need to talk to this person, feel free to indicate that and we'll add that to our process. Okay, excellent. All right, so I'm gonna head back to our deck here. All right, and Trish, you are the last person we heard from, so can you see my PowerPoint well?
Yeah. Yep.
Great. All right, so some other considerations. First of all, I'll ask my colleague Alex to share here in a moment. We would like to automatically incorporate the everyday discrimination scale into our survey, and he can describe what that is. We also want to highlight here the size of the survey. We imagine that this is going to be a pretty significantly sized survey, which is why we are aiming for a 5,000 distribution number. And then, there's a question around collections of how we can distribute. I had a conversation with Tony last evening during the anti-racism task force about, is there a potential to use business reply mail for the city? But are there other opportunities for us to get this information out there? So before we get into that, though, I want to stop here and ask my colleague Alex, would you mind sharing a little bit about the everyday discrimination scale, what it is, and what we feel the utility is for this process?
Yeah, absolutely. So the everyday discrimination scale was created by a gentleman, Dr. Williams, out of Harvard University. What we found is it's a really fantastic way. It's pretty short. It's about 9 questions, but it's a fantastic way to survey people about occurrences in their day-to-day lives. And it gives them the opportunity to explain certain things that they may have experienced or felt, and then draw on why they felt they experienced that discrimination. So this could be things related to your race, your height, your sexual orientation. And because it's so broad like that, it gives us a really all-encompassing idea of why people are experiencing certain types of discrimination in their lives. So this is something we've used in a couple of our surveys. I've worked with it in the past, and I think it would be a real solid addition to this project.
Excellent. Thank you, Alex. Do we have any questions for Alex from the group?
I think I had Alex. This is a great tool. I am aware of the tool. I think I mentioned in our last meeting. I think we've insert, let's think about what is the goal of the ultimate exercise and how this tool fits within those outcome-based, process. Actually, same thing I mentioned about the focus groups. I think how we should think about the designing the focus groups and number of focus groups. So for the everyday discrimination scale, one thing that we should be mindful of is relevance to certain groups such as refugee, immigrants, and low-income minority groups and other groups, because just the one scale may not be appropriate for all. Are there items that is most common for all groups? And I think just identify those items from the entire scale and use those items for the survey. And then may want to think about, do we need to add additional items in terms of microaggression, which is not well captured by the everyday discrimination scale, and some of the subtle nuances of discrimination doesn't really, that's one of the critique of the scale, doesn't capture, this scale doesn't capture those microaggression, and especially how certain communities perceive microaggressions in different ways. Those nuances are not captured. So I think we think about what are the most common items from this entire measure that is appropriate for all versus using the same scale blindly for everybody.
That's really helpful feedback. And definitely we can use this as a starting point. And we could absolutely build off of it as a way to try to find more nuanced information. But no, thank you for that feedback.
Yeah, happy to help, because bias and stigma is one of my areas of publications, and I have used some of those skills myself. So I think happy to help if you need.
Yeah, Dr. Vanek, if you don't mind, I think one of the things we'll try to do as we're developing this draft and review it with all of you, since this is an area of expertise, we may reach out to you about some of those questions. And then obviously we have an iterative process here of review, just so you all get a chance to react to it. So once we do issue a draft of the survey, we would ask everyone to weigh in and provide feedback, and then also come with not only critique, but solutions, right? Which I think is an example already set by Dr. Vanek. So thank you for that. Okay.
And I mean, one thing I wanted to just put it in the forefront, we just rather not just collect data on discrimination, we need to also incorporate resiliency, how those communities and specific groups really cope up with those as everyday discrimination. I think that's where I think we need to start building focus and building interventions on. So I think capturing the resilience is also equally important.
That's an excellent point. Well, we'll make sure that as we put this tool together, that we have a dialogue with you and anyone else who's interested in this too, so that we get the language right. Our hope is to try to make something that's consensus driven as much as we can. But the as much as we can means a lot of detail, and it means a lot of work. So thank you for that feedback, and for everyone for your continued participation. Any other questions for Alex at this point? Okay. So heading back to the slides. And you can see my slides, correct? Great. So, the size of the survey and how we can distribute. So part of what we asked to do in the capacity mapping is that folks indicate what might be available. But I wanted to see, if anyone had thoughts about potential distribution channels. We would like to do it through the mail. We have some money set aside in our budget to go through clearinghouses, but is there anything else that folks can think about, particularly with the longer form survey? Any strategies you think might be useful, maybe even mailing lists that you might be willing to leverage? So if we provided you with the surveys, you could send it out. Anything along those lines. I just want to take a second, see if folks have any of that capacity available to them.
Lauren, this is Trish again. The population that we serve, which is the extremely low income, pretty much centered in one neighborhood, primarily. Not there's some in other wards, but mail is a really difficult way to reach that population. Really difficult. There's a lot of movement, and places with no addresses on the buildings. I mean, we have a terrible time with mail. So I think, we could hand distribute to 1,000 households in Lakewood right now, we're seeing. I mean, it's a possibility that hand delivered is better than mail for this population.
Okay. Well, we may follow up directly with you, Trish. We obviously think it's an imperative of our work here that we gather the voices that we need to, and we enable as much feedback as possible, especially if our tools are not concordant with how people live their lives, i.e. if you don't have the internet, doing an online survey is not going to be meaningful to you. So we'd like to reach out to you about what that looks like, and maybe even offer assistance and see if we can coordinate to not only on distribution, but collection.
Yeah, I'm only bringing the point up. It certainly doesn't have to be us. We have the touch points, but mail is a problematic way to get information from the population we serve.
In all likelihood, it's going to be a both and, where we are able to using mail can be very successful. We can oversample where we need to, but also if there are particular constituencies, we'll try to think about this geographically. So, you talked about it geographically. We'll connect with you, figure out what that means, see if that does any displacement in terms of what mailing targets we have, and then come up with a strategy that kind of meets you where you are, meets your folks where they are. But you also raise a good point, and this is exactly why we're bringing it up. Is there anyone else on this call right now who is facing a similar sort of thing, or would be willing to work with us, volunteer with us in the distribution and collection process for some of our hard copy mail or hard copy surveys, excuse me?
I think this is Jenny from Signature Health. I think we would be able to kind of sort out our population, see which of our people live in Lakewood, and be able to help with that, when they're coming into the office or seeing their providers.
Okay. Yeah, I think we can do that. We'll mark that down, Jenny, and follow up with you. We can come up with specific strategies. Obviously, if it's a longer form survey, if someone's in your waiting room, that's one thing. If they're Lakewood residents, but you can say, hey, leave with the survey, come back, or someone will pick it up. We can work out a appropriate strategy. Anyone else have any particular concerns? Maybe they work with a population or with a segment of folks in the Lakewood community where we might need a bit of a more significant touch point. Okay. Well, in any case, this will be something we discuss again. And I want to thank Trish and Jenny for highlighting some of the particulars and helping us out. We'll follow up with you individually to come up with the best strategy at the right time. So thank you for that. Okay. All right, now I'd like to invite my colleague, Emily Matillo, to help me through the next following pieces here. We have some key discussion questions we'd like to get through, and I'll put these in the chat. And then what I would ask is that, we have an open discussion about some of these topics. When it comes to the survey design, number one, who should we target? And what I mean by that is populations. Are there particular populations that we need to be focusing in on? We've sort of teased out some of this with the focus groups, but this is for survey design. Should we be inclusive in terms of the type of language or specific folks that we want to make sure get this survey? Beyond social determinants of health, which will be included in the survey design, what do you really want to know about the health of Lakewood residents that we won't be able to find from other resources? So, I'm thinking about either existing CHNAs or through ACS data. What do you want to know about folks' health that we can't find or discover through existing systems, right? Because this is what a survey can do. It can help sort of fill in where there may be some cracks, right? Do you have a hunch about what you would like to see confirmed or disproven by local data? So I'll give an example, and it's just meant to be an example. Housing has continually come up. Is there anything around housing, like this hunch that you may have where you say, oh, I don't think that's true, or I think this is true? One question about Lakewood I always get is, I hear that Lakewood's the dentist community between Chicago and New York. Is that true? That sort of thing. Is there anything that you would want to know about Lakewood, confirmed through our survey or disproven through this work? And then thinking about racial equity in particular, what should we be asking to determine the various ways racism is impacting the health of Lakewood residents? We talked about some of these survey elements. Dr. Monica had talked about some of how we account for bias, but what are some other specific things that we should be asking to talk about the impact of racism and racism's impact on health of Lakewood residents? So I'll put these questions in the chat and then sort of open the floor. You can answer any of the questions as you would like.
Hi, this is, can we do this generally by unmuting, or would you like us to type something in the chat?
So I think there's a term that we learned called stacking. So if you put your hand up, it will cue us in the chat. So how you do that is you go to the reactions button in the lower part and you raise your hand, and we'll call on people in that order that they are notifying us that they would like something to say. Of course, if you feel like there's something that you got to say, or if you'd rather do it by chat, we'll document that as well.
Yeah. Gotcha. Well, what I wanted to offer, an opinion about is talking more about how to measure some of the quantity, the more like the qualitative stories that people have about access to care, trust in providers, kind of how COVID also has affected their access to care. I know that in my work, it's everything sometimes to get folks of color to go to the doctor if they feel like they may have COVID-19, or to go get a test. And there are so many other, social determinants of health and other things that affect that. So, I think if we're talking about equity, I personally would like to know some of the qualitative stories that are going on. Do you feel that you have, is your provider local to Lakewood? Do you have to go outside the city to see someone? Do you trust your provider? How long have you been seeing them? Things like that, I think, may help open the door for a person to talk more about their experiences. I have straight up asked patients, do you feel like your provider or doctor takes your culture or ethnic or racial background into account when communicating with you, when helping you to make decisions. So I think there are a lot of questions we can ask on each of the categories that you put forth for the discussion, but those would be just a few of mine.
Great, thank you, Laura. Lots of really good points there, right? This isn't just about measurement in a quantitative way, but we need to understand quality of life. We need to understand people's perceptions, which is a big part of why we want to design the survey the right way. All right, anyone else have any other feedback they'd like to offer? I don't see any other hands raised.
I'm going to ask the who should we target question in another way. So sometimes when we do surveys, we oversample we try to oversample in certain areas or certain groups so that we make sure we get a good response from that. So are there any groups that we would want to oversample in Lakewood? Sometimes it's older adults, sometimes it's an income level, sometimes it's a specific neighborhood. Does anyone have thoughts about that?
Oh, this is true. I'm going to sound like a broken record, I know, but I definitely think really low income residents ought to be oversampled. They're going to be tough to get responses from. And, from my own personal perspective, I'm really committed to making sure those voices, which are hard to hear, are heard. So I would look at low income.
Trish, when you said really low income, are you thinking like 50% of FPL or 100%?
Yeah, 90% of our clients are at 30 or below. I mean, we're talking extremely low. And I would say 50 would be the top end of the population we serve. So, you could use 50 and below.
Okay.
Excellent. Thank you, Trish. Anyone else? Any hunches folks have? Guilt-free hunches. Okay.
So Lauren, are you going to be doing the survey after the focus groups, correct?
Probably concurrent. We'd probably distribute the survey and then follow up with focus groups and key informant interviews. Unless, Emily, am I getting that wrong about our timing?
Because I think it'll be good to at least get a few initial focus groups to identify if you need to add a few additional items in the survey, because focus groups, the stories can direct us to identify additional areas that are beyond the standard SDOH. So I think it would be good. My suggestion will be at least start with the initial few focus groups to identify, do we have to have additional measures survey in the survey? And then you can end the focus groups after you gather the initial survey to kind of see if we are capturing, if the stories matches.
Yeah, that's good feedback. I think that's something we should probably discuss internally about some of the mechanics of how we add to that, because one of the things that we have thought through is not only will we have this longer form mail-in survey, which has its own real material constraints in terms of timing, postage, distribution, collection, analysis, aggregation, so on and so forth, because simply put, we got a lot of work to do and only a certain amount of contract to do it, right? But also we have opened up the opportunity for other survey tools to be deployed or used that might be smaller or more specific. So I think your feedback is good that maybe focus groups and key informant interviews enable us to identify things we're not thinking of that are important to collect in a survey-like format. So we'll think about that in terms of our timing and what the best approach is. And then when we come back in January with a draft, we'll sort of outline some of our approach in that specific area. But maybe when we do discuss with you some of the question pieces around discrimination, we can also have a conversation about like the mechanics of the timing and how that works operationally. Okay. Emily, is there anything else that you would like to add on that point?
Yeah, I just would, earlier when Jessica was introducing herself, she, I think, had some really good points about making sure that when this turns into a plan, that the plan can actually be put into action and that we see results from it. And so I'm wondering, I know it's a little hard to think backwards, but if there's anything that we could ask in the survey or information we could gather that could make actionable items more possible to identify. I guess, does anybody have thoughts about that now, or you know, if you do, let us know, because it's easier to identify those things if we have the right data collected.
So this is Jessica. Thanks for referring back to the action plan. It's not just our group or any groups that we are dealing with. Everyone's dealing with, you know, that action item, you know, going through with that. But I think one thing that we are missing is, I think I'm going to focus on number 4 of this question is, and what Trish was talking about, how there's low income families. Like, how did they get there? How did they get to that level of low income? It could be circumstances like utilities or services, or they're not from here, they're refugees, or, you know, Lakewood is a unique community. It's not just African Americans or Hispanics. There's a lot of different cultures in Lakewood. So we need to think about that. We need to think about, you know, is it transportation that they don't have access to? So these are things that maybe if we have an understanding of how they got to that point, then that can dictate the survey too as well.
So something that sort of documents the journey of where these challenges might have sprung up, or their sense of economic mobility or immobility, for lack of a better way to describe it.
Correct.
Got it. Okay. All right. Anything else from the committee, or Emily, do you have any other items you'd like to address? Okay.
I don't think so, but as you think these things over, if things come to you, please let us know. I know that I have some hunches about things in Lakewood from spending some time there that I'm interested to see if are true or not. So if you have some of those hunches, but don't necessarily want to air them in this forum, you know, you can also email Lauren individually, and we can make sure those things are explored in the survey.
Absolutely. Absolutely. It's an open-ended forum. We're here to in service of you all. So
this is Jessica again. Before I forget, because I'm probably going to forget, one hunch that I'm going to put out there is where you live in the community, east side versus west side. You know, some people think the west side is better than the east side because it's bordering the city of Cleveland. So those are the two. That's one of the hunches that is really big in Lakewood.
Yeah, that's good feedback. So it may be something along the lines of, does geography alter your perception of quality of life in your neighborhood?
Correct. Correct.
Okay. Great. Okay. Well, thank you. Oh, Martha, yes. Oh, claps. Those are claps. It's not a hand raise. I just want to make sure.
Wrong one. Yeah, to Jessica's point, actually part of some earlier work, we actually did some basic mapping of Lakewood to actually look at, for example, where are concentrations of lead poisoning, or do we have a sense of where concentration of chronic diseases persist. So this is a really important approach for us as a health department. Obviously, we recognize which populations are disproportionately impacted by illness and disease, and we also understand the impact that community conditions and opportunities play in those poor health outcomes. So looking from the perspective of place, but also race and ethnicity. So unpacking that is, I think, really important. And we did do some of that geographic mapping. Even if there were geographic mapping of some of the information that is collected by survey and focus group, what are folks sharing about their needs and challenges in relation to other parts of the community. So I think those are really important points, and I think a really important consideration to be able to understand those various impacts and the various experiences of folks in Lakewood.
Thank you, Martha. I appreciate that. And also, if you are willing, I know that the county has its own process, but if you have any either basic shapefile stuff or databases specific to Lakewood that you'd be willing to share that you think, and I'd say throw everything in, we can incorporate that into our process and would be appreciated. Feel free to reach out to me directly if need be.
Sure. I'll look back and pull out what we have. Absolutely.
Thank you very much. And I know we have a lot already, but I always like to make sure if someone's saying it, might as well get 2 of something than 0 of nothing. If that makes sense.
I mean, it's not current data, but it'll give a sense of how we looked at it and what was mapped at that time.
Sounds great. All right, Emmy, I see your hand is up.
Yeah, just piggybacking on all that Tricia said about housing being such a critical consideration for people right now, and how that impacts families. There's no continuity of support when someone leaves the city when it comes to youth. So the supports that are built up around a child within the school district and community service agencies, and even the more informal and grassroots neighbor supports dissolve and completely dissipate. And, I'm just thinking of a student that recently left and was, getting a lot of support toward graduation and is now in another district and probably at high risk of not graduating. And my hunch is that with youth surveys, isolation is going to be a prevalent theme. And while that is at least somewhat tied specifically to COVID, that doesn't make it a short-term consideration. I think it's something that's going to resonate for many, many years. And that's social isolation, being cut off from public spaces and community, and also resources, because I think, for families for whom healthcare access is not available, they've missed opportunities to connect to that through the schools over the past couple of years.
That's a very good comment. Thank you for that. I think, that's insightful too about the type of things that we'll need to think through when we get to the action plan level of work, because if you're talking about continuity for folks that are moving in and out of Lakewood, one of the sort of informal data points I think we've heard is that there's a lot of transients in the community. The renters moving around, families moving in and out. So how do you accommodate for that sort of thing? I think that's an important thing to look into. And certainly, when we are talking about engaging youth, isolation, the impact of isolation, what do you do about that? Is your hunch correct, right? We know the NIH has said certain things have been happening, right? We know that adolescent suicide rates are increasing. What's the situation in Lakewood? How do we measure that? What do we understand about it? So thank you for those comments. Okay, so I think at this point, what I'd like to do is move on into our next section here. So thank you, Emily and Alex, and for all of you for your feedback. Next, we'll just quickly review the capacity mapping survey. So all of you should have received a link to our SurveyMonkey survey on capacity mapping. If you have not, or if you would still like to fill it out, the link is still live, and so we can still collect responses. But to give you a sense of what we found, we had 15 responses in total between the advisory and steering committees. A third of individuals who filled out the survey do have space for use. So, 5 people said that they may be able to lend space. 4 individuals said they could connect to local groups in which they participate. So as we're, putting out information, they could share that information and help us distribute. we also know who is able to do what. So we may be reaching out to anyone who filled this out and indicated what they did. 6 stated they could distribute info that there may be some protocol needs. So some of you may maintain listservs or produce newsletters, but are not able to just hand us over a CSV file with people's information. That's totally understandable. So as we cultivate some of our outreach tools, we'll probably engage you and ask for your help in distribution or determining the best way to help people get connected to the process. A number of you said that you can help share information via social media. So as reports come out, as community meetings are announced, or if folks need to sign up for a newsletter, that's a hint for our next section, you could help us promote that information through social media channels. We'll work with all of you on that, and Patty and Ebony will describe some of what that may look like when it comes to just sort of getting people connected to the information generally. And then some other potential considerations that folks shared, potentially money for childcare, food, or participation. We really appreciated this feedback. I know that for some community meetings, folks work different hours, right? They may work at night, or they may not be around during the day, or, there might be other needs. So, how do we make sure that people can access the resources that we're going to offer in terms of stakeholder input? So, if there's an opportunity to provide childcare at an event, we might be able to do that. Also, connections to small business owner groups. We sort of highlighted this before, but I think it will be important that we get to all parts of the community, right? There is no single entity or group that represents the entirety of the Lakewood community. And so in this respect, connection to small business owner groups might be helpful. And then also the utilization of community health workers. So if there are elements where we might need to do some other different types of outreach with trained folks who understand the community, how can we deploy some of those resources as well? So I'll stop here for a second, see if there's any questions about the capacity map. Okay, it's pretty straightforward. It's just a way for us to index very simply how we can exploit the resources that you bring to bear. It's a way to keep this project inexpensive, A, and B, also, and maximize our connections into the community to make this meaningful. So if you have not had a chance to fill this out, it will still stay open through the end of the calendar year. If you need the link sent again, just send me a note at lanthus@communitysolutions.com. I'm more than happy to send you that survey again. Okay. So I think that brings us to our last section, communications. And so I'm going to hand it over to my colleagues, Patty and Ebony, who can give us an update here on a particular strategy within our communications plan. Okay, I'm not seeing, perhaps they got dropped real quick. See, Ebony is here. I do not see Patty. Ebony, are you available to speak to the communications work?
Sure. Excuse my voice. So
all right, I'll pull up the slide real quick. There you go.
Hi, I'm Ebony Thornton. I'm communications coordinator for the Center for Community Solutions, and I coordinate communications. So our plan is to have an internal messaging and external messaging. Internal be a little more kind of detailed, but externally we wanted to we want to do a 2-minute what we're doing and kind of pull people in, and then open it to all the great things that we're planning on doing. So the goal is to make sure that our communication is inclusive, it's also responsive, it also is hitting all the points of the plan that we have. At the last meeting, members really liked the Cambridge model. They also liked having the overarching umbrella of question regarding equity. So we want to kind of include that as well. in a lot of our communication packaging and messaging as we're moving forward. And as we were doing the plan, we wanted to make sure that we can answer those questions quickly when we're having, when we're at an event or we just want to kind of pull people in. So we will have kind of elevated, elevator speeches. We have a QR code. So if someone's like out, drinking hot chocolate with their family and they're like, okay, we can't really stop, they can take a picture of the code and it will open on their phone and they can walk and hopefully not text, but walk and read, or maybe walk and stop and drink hot chocolate as they read about the project. We're also in the process of updating the website to make it more user-friendly. We would like to collect information, like those who are interested, that we can contact them through our listserv, maybe other listservs as well. So these are just a couple of things that we're coming up with. Another slide, or sorry.
No. So let me go back. So this QR code is live. So if you opened your camera, it would take you directly to our splash page where individuals could sign up for any announcements from the group. This is concurrent with our website that Ebony mentioned, communitysolutions.com/Lakewood Health. So, as you're out and about, this will be a useful tool to say, hey, why don't you sign up? You'll get notices about community meetings, major report releases, that sort of thing. I will also mention here that we're finalizing the packet of information regarding messaging and different tools. So once that's finalized, we will distribute this to all of you. So you'll have a copy of the QR code. You can download it. You can post it on social media. You will have some commensurate language that you can use in order to promote the information however you would like. And then the other thing I would just mention here is that this came up, and I'll stop sharing for a second so we can have a discussion. This came up during our last steering committee meeting because there were some events that Lakewood was holding where we wanted to make sure that people could access that information. So part of our ask to you not only is, hey, as we give this to you, would you promote through social media? Would you incorporate this in any sort of displays that you may have or community bulletin board type of stuff? But also, if you know of any events that are coming up, do you see a need or a potential for us to be there? So if the answer is yes, you can either take this information and use it as a part of your own network. So, if you have a table already set up at, a Lakewood event, you can include that, like learn more about our CHNA, and you'll see what that looks like. You can just print out a poster page and it will give you some talking points. But also if you need CCS staff support, we can try to be there as well. So all I would ask with that is please reach out to myself, Ebony, or Patty about any opportunities for us to promote this event. And if you need help in developing those materials or you want to walk through some messaging, we're happy to do that. Or if you just need an extra hand for that event, we're more than happy to work with you and coordinate things. So thank you, Ebony, for that information. Do we have any questions from folks around the table about the virtual table, about these tools, or any thoughts or considerations, things questions that they may have for Ebony and I? Okay, I'm not seeing any. Just a general sense, does it make sense? We're just giving you information so you can help us promote how to sign up for a newsletter. Okay, great. So we will distribute this to all of you. Our ask would be, please post it on social media, put it on your bulletin boards. If there are events coming up, let us know what you need. All right. Okay, thank you. So last bit here, some next steps for us. Okay, so between now and our next meeting, we hope to have some level of draft survey available for community review. So we'll go over the basics of the survey's design and the questions that are being asked. We're also going to reach out to all of you about various databases that you may have. You know, we already sort of heard from some of you about some resources that you may have at your disposal. Martha had mentioned, you know, that the county department already had some information on Lakewood regarding, I believe you cited lead poisoning or lead paint exposure. That sort of information is going to be very useful to us. We already just discussed the event advertising. So if there's events that are coming up, if there are different community-oriented engagement opportunities for us to promote the CHNA and participation from Lakewood members, please let us know about that. And then obviously survey distribution and feedback collection. You know, I think Trish had mentioned, you know, she's already enmeshed in one network of folks that it may be good to touch a point with. So, you know, who else has different constituencies, different populations where it may be helpful for us to work with you about how we distribute survey information, that it's the right type of survey, and how do we get that information back so that we can get a good representative sample from the city of Lakewood. Okay, so that's everything we had to share today. Do we have any questions about our next steps? I'm not seeing any. Any questions or comments about anything that was presented today? Everyone just sees that we're 45 minutes early and is just looking for that 45 minutes back, but just in case, you know. Okay. As always, if things occur to you, if you need any more information, if you know of an event that's coming up, if you need additional detail, please reach out to us. Let us know what you need. We are here in service of you and of the residents of Lakewood to make sure that this process is effective. So it's on all of us to make sure that that happens. With that, unless there are any other comments or questions, you will get that 45 minutes back. I want to thank all of you for your flexibility on the scheduling between this month and last. For those of you who celebrate, have a good holiday season. Happy New Year, and we will see you in 2022. All right. Take care, everyone.